COVID-19 vaccinations ramp up around the world, this winter could be complicated with both the threat of COVID-19 and warnings that the flu season could get started earlier than usual this year. This morning, we're joined by Dr. Reena Mehta with a look at what could turn into a double threat in the months ahead. Dr. Mehta, good morning to you.
Good morning. Thank you so much for having me.
So I know this is the last thing we want to have to talk to people about, but it's a reality that we need to acknowledge, address, and hopefully prevent. So I guess what are the thoughts of medical experts right now as far as COVID-19 and dealing with flu cases are concerned?
So experts are coining it the twindemic, which is both COVID and flu. And, we're really hoping to not see that surge this winter and not have a twindemic. But of course, there is a concern as, the country is opening up more. We are worried that, with the two overlap, it could be a lot worse than last year. So last year, flu season 2020 was a lot different than we've ever seen because of good hand hygiene, masking, restriction with traveling. We really saw very little flu activity last year. But, this year could be quite different because obviously, kids are back in school, people are doing regular things. And so that's the concern is that, if those numbers surge, what to predict and what to expect.
And so you and I we were talking just before we started here on air, and you were saying the way you all can kind of gauge or guesstimate what our flu season will look like is by looking at other parts of the world. So the other side of the world, if you will. So Australia, which is in they're going into their summer now, or their spring, I guess.
Exactly.
Go ahead. I'm sorry. Go ahead.
We look at the Southern Hemisphere for flu predictions because their flu season is earlier than ours. And so places like Australia and China usually hit their flu peak season in about August. And so, they're different. Australia actually has very low flu activity because they're still doing a lot of restrictions and restricting travelers coming in, whereas China has had more of a moderate flu season because it's more open up to the world. And so I think in the United States, we're predicting that we're probably going to have more of a moderate flu season this year.
So I know people are all at home wondering, like, okay, we're not there yet. We don't have to have this moderate flu season. What can we do? How can we prevent this? What's your answer to that question?
So that's a great question. And so obviously the things that we already know, so masking, good hand washing, social distancing as much as possible within reason, and also vaccinations. And so flu vaccines are available already. You can go to your local CVS, Walgreens, or your primary care and get your flu vaccine. We usually recommend getting the flu vaccine in October, so this is perfect timing. Also, if you have not yet been vaccinated for COVID, that's also an option. And a big question comes up is, can you get both of them at the same time? The answer is yes. You can get your COVID vaccine and your flu vaccine at the same time if you desire. So you don't have to wait. There doesn't have to be an interval between both of them. And, we think of the flu being spread by children. And so now that we're entering, potentially getting the COVID vaccine for ages 5 to 11, Pfizer will be presenting their data to the FDA within days. It's possible that our children 5 to 11 years old will also have the opportunity to get the COVID vaccine this fall.
And Dr. Mehta, really quickly, I know you were kind of leading up to the question that you keep getting, can you get both at the same time? And you were talking about the vaccine, but you could also technically get COVID and the flu at the same time, correct?
Unfortunately, yes. And that's where we worry about those patients the most because they're likely to get pretty sick and a lot of the symptoms overlap. And so if you have, fever, cough, runny nose, and you're going to get tested, you will probably get tested for both COVID and flu, PCR tests for both of them at the same time, because it's important to know which one is driving your symptoms or both, because treatment, depends on which actual virus you do have, and the treatments can be different.
But the key is we can at least try to prevent severe cases of both of those by vaccination, as you mentioned, masking, hand washing, social distancing, and I think the big one that people might have slipped out of practice of is staying home when you don't feel well. Don't be out in public around other people. Keep those germs to yourself if at all possible.
Absolutely, and get tested if you have those symptoms.
All right, Dr. Mehta, we appreciate those reminders that flu season, even though we're still dealing with this pandemic, is upon us. So everyone needs to be taking care of that as well. Thank you so much for your time.
Thank you so much for having me.